Good afternoon, everybody, and I welcome you all for this session on chronic pain management, which is being telecasted along with in association with Six Eye Pain Healthcare. And I am Dr. Venkatesh Nevagi. I am from Goa and practicing interventional pain medicine for the last 12 years in Goa. First of all, to begin with, I would like to address the pandemic which we are going through. And from my bottom of my heart, I would like to say thank you and salute the all the frontline health workers and police, the fire workers, the other people who are taking care of all the patients and all the stress at the front line. I would like to say a big thank you to them, and because of you all, we are living very safely here. Today, we'll be talking about chronic pain conditions like low back pain, knee pain, shoulder pain, neck pain, joint pains. But I'll be focusing more on one aspect of these problems, which is diagnosis. Because often we see that in these conditions, we don't come to a proper diagnosis before treating the patient. Like समझो कि किसी को अगर बुखार आ गया है और वो किसी डॉक्टर के पास जाता है, 4-5 दिन का बुखार तो हम नॉर्मल इन्फ्लुएंजा कहते हैं और उसको सिर्फ पैरासिटामोल दे के घर भेजते हैं। पर अगर कोई बुखार 5 दिन, 7 दिन, 10 दिन के ज़्यादा रहता है, then we start worrying about it, isn't it? So अगर किसी को 10-12 दिन बुखार है with chills, rigors and you suspect malaria in that patient, तो हम लोग कुछ ब्लड टेस्ट करते हैं जिसमें मलेरिया रहता है, डेंगू रहता है, टाइफाइड का टेस्ट करते हैं, टोटल काउंट करते हैं, एंड देन वी ट्राई टू कम टू अ डायग्नोसिस, इजंट इट? तो अगर मलेरिया निकला तो उसका ट्रीटमेंट मलेरिया के ट्रीटमेंट के हिसाब से होता है, या फिर डेंगू निकला तो उसका ट्रीटमेंट डेंगू के ट्रीटमेंट के हिसाब से होता है. So before treating any condition, what I want to stress is a proper diagnosis is very, very important. Or same thing in abdominal pain. अगर किसके पेट में दर्द है, तो डॉक्टर विल ट्राई टू फाइंड आउट वेदर जो पेन है वो कहीं अपेंडिक्स से आ रहा है या लिवर से आ रहा है, गॉल ब्लैडर से आ रहा है, female is it because of twisted ovarian cyst or ectopic pregnancy, kidney stone. So doctor tries to find out the source of pain kya hai, and accordingly only we start treating the patient. So similarly, in low back pain, there are so many things which can cause pain. Like you have a disc causing pain, you have a vertebra, which is a bone, which can cause pain. Then you have the facet joints. Facet joints are the small joints which are at the backside of spine, and that can give rise to pain. These joints are something similar to a knee joint. A knee joint bada rehta hai, lekin these joints are very small and they can undergo arthritis and cause pain. So all these structures along with muscles, ligaments can also give rise to pain. So before treating any back pain, we need to first get to a diagnosis. काफी बार ऐसा होता है कि पेशेंट हमारे पास आते हैं और पूछते हैं कि डॉक्टर मेरा लो बैक पेन है, मेरे को सायाटिका है, या फिर मुझे स्लिप डिस्क हुआ है, and I need treatment. Before treating the patient, we always try to stress on finding out something called as pain generator. Pain generator is nothing but any structure in the lower back which can give rise to pain, be it a disc, a facet joint, a nerve, or a vertebra, or muscles and ligaments above. So similar thing can happen in neck pain also. गर्दन में काफी बार दर्द होता है, तो people just say it's spondylitis, but spondylitis is just a vague term, as I said, like fever. But you need to find out whether patient is having a joint pain or a disc pain or radicular pain. तो एग्जामिन करने के बाद डॉक्टर हैज एन आइडिया कि ये पेशेंट को क्या हो सकता है, whether it's a disc related symptom or patient has had a fall and something like we call a whiplash injury which can give rise to a facet joint pain. So doctor will try to take a proper history. Doctor will do a good examination and maybe order some investigations like cervical X-ray or lumbar X-ray. And if needed, the doctor will say that you have to go for MRI, because most of the problems in the spine, they come from disc or nerves or soft tissues. So MRI is a very good investigation in approaching a diagnosis in spondylitis or slip disc cases. So what we'll do is we'll try to see one by one the different conditions which we can treat in this vast area of pain management. So to start with that, and as I'm talking, I'm going through your comments and questions. If you ask me any question, I will try to answer it. So I got a question from Kumar Velu, so who says that my grandmother has 70-year-old has is 70-year-old and she's suffering from knee pain for more than 10 years. Taken tramadol tablet continuously and she's taking BP tablets also. So he wants to know how to reduce tablets. Look, Mr. Kumar, that her blood pressure tablets to unko lena hi padega, because that is one thing which you should not stop unless your physician asked it to be stopped. So let her continue her blood pressure tablets. But regarding her knee pain, what I would suggest is that most probably at 70 years she's suffering from osteoarthritis of knee, and tramadol is a very basic drug which is taking, which is very safe if taken in long duration, over a long duration. So she can continue taking tramadol, but along with that, if she can do some exercises and physiotherapy and maintain her body weight, then it would benefit her. So at 70 years, you don't expect her to do rigorous exercises, but there are some knee specific exercises which a physiotherapist can advise you. And along with that, if you can give her tramadol with paracetamol, which is a good combination. But over a period of time, this pain can worsen. So in case that happens, then probably you can look at some different treatments like interventional treatments, depending on the stage of arthritis. If it's early stage, then we do a lot of viscosupplement, and recently the novel treatment called as platelet-rich plasma, which is very effective in early stages of osteoarthritis. So that can also be done. I hope I've answered your question. Hardik Shah is asking about trigeminal neuralgia. See, trigeminal neuralgia is pain coming in the face. It could be because of there is a big nerve called as trigeminal ganglion at around this area, just under the brain. So irritation of this nerve can give rise to trigeminal neuralgia. So, depending on the severity, the treatment will go. Like if the symptoms are not very severe, then medication should help. Carbamazepine is the drug of choice for these patients, and so there are a lot of patients who are comfortable on carbamazepine, maybe 100, 200, 400 to 600 milligrams a day, and they are quite comfortable. But if high doses of carbamazepine is not helping the patient, then we do some procedure called as radiofrequency ablation of the trigeminal ganglion, which is a very minimally invasive procedure wherein under a CT guidance or X-ray guidance, we just approach that nerve with a small cannula, small needle, and we pass a radio current under guidance, and we first stimulate the nerve, and we can block the nerve for a few months to a year. So generally the pain relief is very good. But there is another condition wherein a blood vessel can irritate the nerve, and there is a lot of friction between the blood vessel and the nerve. In those conditions, then the patient may have to undergo a surgery wherein they put a Teflon patch between the nerve and the ganglion to relieve the nerve of pain. So there are many approaches available, many options available, but medication is the first line of treatment. Okay, Hardik? Uh, Dayanath Kurmi is asking, should people still get screened for cancer during a national emergency? Well, this if you're talking about the present COVID pandemic, I would say that you have to be little safe and little careful during these times. If you don't have a very strong positive history of cancer at home, then you need not worry too much. But then, if you have crossed certain age, say more than 40, and you have a very strong maternal or paternal history of cancer, and you are having any symptoms, then probably you should get screened for cancer. But in these times, I would rather ask you to avoid going to a screening test for cancer. There's another question from Hardik Shah. If you're the same person, sir, has transdermal patches any role in management of sciatica pain, and if yes, how effective? As I said earlier, that sciatica pain is like fever. You have to first come to a proper diagnosis. What is causing that sciatica pain? So sciatica pain can be caused generally by a slip disc, which is irritating your nerve root. So if that is the case, then you have to treat the causative factor first. Just for pain's sake, yes, you can take a transdermal patch. Uh, you can take a NSAID patch if the pain is not too much, but it's a neurotic pain. You can take something like buprenorphine. Buprenorphine patch is a narcotic patch. One patch works for about 7 days. It gives good pain relief, and patient can be pain free for 1 week with one patch. It comes in 5 milligram, 10 milligram, 20 milligram patches. So depending on your requirement and severity of pain, you can try from 5 milligram go up to 10 milligrams. As buprenorphine is a little stronger, there is a little milder version called as fentanyl. So that's available in 20 micrograms per hour and 50 micrograms per hour patches. So you can try these two patches also. Uh, Sanjeev Sharma. Yeah, Sanjeev Sharma is asking about, my cousin brother has severe pain in spine sometimes. It's very severe and remain for long time. Please advise, sir. Yeah, this is like the symptoms patient come with. Now we have to see as doctors, yeah, where exactly is the pain in the spine? Is it lower back or it's cervical spine? Considering your cousin is a young boy or a middle-aged person, and he has severe pain for long time, then you need some investigation, sir. We need to find out whether his muscles are having a problem, or it's a disc prolapse which is giving him pain, or it's a radicular pain going down the leg. So I would like to examine a person like this and do some clinical tests to find out whether the patient pain is coming from his disc or a facet joint, or it's a nerve, or it's just a muscular pain. Generally, muscular pain does not remain for longer time, so it could be because of the disc, and which needs investigations like X-ray, MRI, and further treatments. One important aspect I want to tell especially in lumbar and cervical spine, that even after doing CT scan, X-rays, MRIs, sometimes the diagnosis is not very accurate. So what we do as pain physicians is we do something called as diagnostic injections. There are many times when patients come with a MRI which shows multiple lesions, L3-4 disc prolapse hai, L4-5 disc prolapse hai, L5-S1 disc prolapse hai, facet joints bhi arthropathic hai, there is SI joint tenderness on examination. So we are also confused that which of these structures is actually causing pain. So what we do in these conditions is we give something called as diagnostic injections. That means we take a numbing medicine, जिसको हम local anesthesia बोलते हैं. We take local anesthesia medicine and we block one structure by one structure at a time. Like if we are suspecting that the pain is coming from a facet joint, so what we do, we put the local anesthesia medicine on a small nerve called as medial branch and block that nerve for some time. So it's like if your joint is painful and we are blocking the nerve supply to this joint temporarily, what is going to happen is you will get pain relief for some time. But what we need to know is that whether how good your pain relief is. If the pain relief is good, that means after the numbing medicine injection, patient says that most of his pain has gone away. That means we confirm the diagnosis that his pain was coming from that particular joint, and then we can treat this joint. For a facet joint pain, there is a very good treatment called as radiofrequency ablation of these small nerves, which are called as medial branch nerves. So this is the only validated treatment in the world for a facet joint origin pain. What it does is we pass a radio current and block this nerve so that the pain coming out of the joint gets relieved, and which can last anywhere from 3 months to 3 years. And after that, we put the patient on good physiotherapy, certain medications, some exercises are given, and most of these patients do very well. I've had patients after a facet joint injections, they are fine for almost 3 to 5 years. And the best part about this is that you can repeat the injection treatment, this therapy, if the pain comes back after a few years. So it's not a very invasive procedure and a very very good procedure for facet joints. Manish Kumar Thakur, he's asking something about COVID. Dear sir, please guide what should one do if a person come to know that the person has come in contact with a corona positive case. First thing is Mr. Manish, आप डरिए मत, घबराइए मत. Corona is not a very very deadly virus. लेकिन it's new, so even doctors are not 100% sure what is the progress of the disease. So that is why we are all in a doubt. पर एक चीज ऐसी है कि over last 3 months or 4 months we have seen, especially in India, अगर किसी को कोरोना हो भी गया तो भी वो डेडली नहीं होता है. It's only less than 3% mortality rate in India so far. We've had more than 2 lakh cases and under 6,000 deaths. So that means it is less than 3%. तो आपको ये करना है कि if you are sure that you have come across a patient of corona, then you need to go and check with your local health authorities. Probably they will test you. So when once tested, you would be either positive or you would be negative. If you're negative, you still have to be under observation for few days. And if you are positive, of course, depending on your local administration, जैसे अभी गोवा में, if the test is positive, then you are taken to a hospital and you are treated there till you are negative and sent. So first thing, don't worry. But if you are doubtful that you have come across a person who's positive, then you should, I think, go and see your health authorities in your local area. As I will wait for a few more questions, as I was saying that what are these diagnostic injections? काफी बार क्या होता है कि जैसे मैंने बोला कि स्पाइन में इवन डॉक्टर्स आर नॉट वेरी श्योर व्हाट इज द पेन जनरेटर, या तो डिस्क है या नर्व है या मसल है. सो दीज डायग्नोस्टिक इंजेक्शंस लाइक मीडियल ब्रांच ब्लॉक जो अभी मैंने बोला, या फिर हम एक और चीज को सिलेक्टिव नर्व रूट ब्लॉक कहते हैं. सो टू गिव एग्जांपल ऑफ अ सिलेक्टिव नर्व रूट ब्लॉक, काफी बार हम लोग देखते हैं कि पेशेंट को 2 या 3 डिस्क प्रोलैप्स रहते हैं और उनको पैर में दर्द जाता है जिसको हम सायटिका बोलते हैं. तो ये तीनों नर्व्स को ट्रीट करने की जरूरत नहीं होती है काफी बार. अ, आमतौर पे अगर आप देखेंगे तो कुछ सालों बाद, 30 या 40 साल के बाद, हर किसी के बैक में या नेक में डिजनरेटिव प्रोसेस स्टार्ट होता है जिससे कि डिस्क बल्जेस, जॉइंट आर्थ्रोपैथी, लिगामेंटम फ्लेबम हाइपरट्रोफी, ये चीजें काफी बार एमआरआई में पाई जाती हैं, विच आर नॉर्मल. दे आर जस्ट एजिंग प्रोसेस, सो वी कॉल इट डीजनरेशन. पर ये जरूरी नहीं है कि एक बार आपका स्पाइन डीजनरेट हो जाए तो हर बार वो पेन देगा. So we need to discriminate, we need to distinguish between a simple degeneration and the problem which is actually giving you trouble. तो काफी बार दो नर्व्स प्रेस मिलते हैं. So what we do at this time is दोनों नर्व्स पे at different intervals, different times हम लोकल एनेस्थीसिया का ब्लॉक देते हैं to come to a conclusion कौन सा वाला नर्व एक्चुअली पेन दे रहा है. तो मान लीजिए कि अगर आपको L4 और L5 ये दोनों नर्व्स पे प्रेशर है, तो हम लोग एक दिन L4 नर्व पे इंजेक्शन देंगे और आपको पूछेंगे कि पेन रिलीफ कैसा है. दूसरे टाइम पे L5 नर्व पे लोकल एनेस्थीसिया का इंजेक्शन देंगे और पूछेंगे कि अब कैसा लग रहा है. सो पेशेंट नॉर्मली टेल्स, अगर उसका एक नर्व का पेन है तो बोलेगा कि मेरा पूरा पेन चला गया है. इफ हिज पेन इज कमिंग फ्रॉम बोथ द नर्व्स, तो बोलेगा कि पार्शियल पेन रिलीफ वाज देयर आफ्टर L4 ब्लॉक एंड पार्शियल पेन रिलीफ वाज देयर आफ्टर L5 ब्लॉक. तो इस हिसाब से हमको मालूम पड़ता है कि पेशेंट का दोनों नर्व्स को ट्रीटमेंट देना जरूरी है कि एक नर्व्स का ट्रीटमेंट दे के ही उसको फायदा होगा. सो अननेसेसरी वी अवॉइड ऑपरेटिंग और इंटरवीनिंग एट मल्टीपल लेवल्स. ओके, मोनिका गुजराल पूछ रही हैं कि सर आई एम हैविंग पेन इन अपर आर्म फॉर लास्ट 1 month एंड डॉक्टर से इट इज ड्यू टू सर्वाइकल, व्हाट शुड आई डू. यस मोनिका, अपर आर्म पेन कैन बी बिकॉज ऑफ सर्वाइकल प्रॉब्लम. तो एक तो आपकी जांच होनी चाहिए. तो आपको तो मैं आई विल एग्जामिन यू फर्स्ट एंड ट्राई टू फाइंड आउट वेदर देयर इज एनी पेन इन द नेक और द साइड ऑफ द नेक and do certain tests to find out whether your nerve is getting impinged and you get that same pain in your arm. If there is any tingling numbness going to your hand, then it's more likely that nerve is getting irritated, nerve is getting compressed. So upper arm tak matlab the levels of the cervical spine which are involved are upper cervical spine like C3-4 या C4-5 tak. Okay, so you need to undergo some physiotherapy as you are doing exercises related to cervical, as you say, and probably you will undergo X-ray and MRI to confirm the diagnosis, and then take it from there. Certain medications will also help you. If there is too much of pain, then you can take muscle relaxant and analgesic for a few days. But I think doing exercise will be a good option. So keep continuing, keep doing exercises continuously, and I think you should be relieved of your pain. So another aspect of diagnostic blocks is something like अगर किसी के डिस्क में प्रॉब्लम है, तो आमतौर पे होता क्या था कि अगर एमआरआई में डिस्क दिख रहा है, लोअर बैक में पेन है जो पैर में जा रहा है, तो सर्जन्स यूज्ड टू नॉर्मली ऑपरेट ऑन दैट. बट काफी बार हमने देखा है, इवन आई हैव एक्सपीरियंस्ड इट माई सेल्फ, दैट कपल ऑफ टाइम्स आई रिमेम्बर एक दिन एक लेवल पे सर्जन ने ऑपरेट किया एंड the pain was not relieved from the patient, so next day they had to operate on the next level. So this can be avoided if you do a procedure called as discography. If there is a doubt whether one disc or two discs are giving trouble, then what we do is something called as provocative discography, in which we inject a substance in a medicine in the disc and increase the pressure in that disc and try to reproduce the pain which the person normally has. If that particular disc is the painful structure, then the patient on table tells us that yes, this is the structure, this is the normal pain which he gets. If that is not the case, then you go in the other disc and see whether that disc is painful. So this is something like, doing an angiography before doing angioplasty or a bypass surgery. You always want to know how many blocks are there, where the blocks are there, and then only you do angioplasty or a bypass surgery. Similarly, in here, before operating or before intervening with the spine as a treatment, one would always want to do a discography and confirming which disc is the painful structure, and then accordingly treat it. So Mr. Dinanath Dinkar पूछ रहे हैं कि my mother is suffering from chronic back pain for past several years. As long as the painkiller medicines she's taking, the pain remains comfortable, but when the medicines are stopped, uh, the pain starts again. ओके सो जैसे मैं कह रहा हूँ कि आपकी मदर का एक्चुअली डायग्नोसिस ठीक से होना चाहिए. एज आई सेड, पेन कहाँ से आ रहा है? If she's taking painkillers for last several years, then I think she needs a lot of investigation and probably the diagnostic procedures which I have suggested. If she has not done her MRI, X-ray, then I think you should get it done, and then probably we can find out what is the structure which is causing pain, and accordingly we can treat it, whether it's the disc which is causing pain, or it's the canal stenosis which is causing pain, or it's the radicular pain which is giving her more trouble. So according to her diagnosis, we can treat her. So there are specific treatments for specific diagnosis, as I've already mentioned. So I hope I answered to your query, Mr. Dinanath. We have another question from Dayanath Kurmi. Sir, what is tennis elbow? Is it arthritis? No, Mr. Kurmi, it is not arthritis. It is a tendinitis, because tennis elbow जो कोनी के साइड वाले हिस्से में टेंडन रहता है, मसल का जो लास्ट पार्ट हड्डी में अटैच होता है, उस टेंडन को अगर सूजन आ जाए तो उसको हम टेनिस एल्बो बोलते हैं. टेनिस एल्बो आमतौर पे जो लोग स्कूटर चलाते हैं या फिर स्क्रूइंग मूवमेंट्स रहते हैं, कपड़े कपड़े धोने लायक कपड़े जो धोते हैं, चपाती वगैरह करते हैं, सो दैट काइंड ऑफ मूवमेंट, रिस्ट मूवमेंट, that can give rise to a pain in the elbow because of the last attachment of muscle getting inflamed. तो इसके लिए आपको कुछ मेडिसिन्स, physiotherapy is very good option for tennis elbow, and you need to avoid certain things like those movements which cause pain. You could wear elbow support, and if all this is not working, then recently what we have started doing is something called as platelet rich plasma injection. इसमें हम क्या करते हैं कि पेशेंट का खुद का ब्लड लेते हैं. We take a sample of patient's blood, we put it in a special machine, और उससे प्लेटलेट रिच प्लाज्मा सेपरेट करते हैं बाकी सेल से. मतलब WBCs, RBCs are separated, and platelet rich plasma is the good part of the blood which is regenerative therapy, and that is injected in that part of tennis elbow. And what this does is it starts healing the inflamed process. जहाँ पे inflammation है, वहाँ पे अगर आप PRP inject करोगे, so that starts healing process in that area. And this is worked very well for a lot of sports people who get these injuries. So this is a very upcoming, or rather it is very established treatment now, and that is very good for tennis elbow. हर्षा देवप्पा पूछ रही हैं कि डॉक्टर, हाउ आर डिप्रेशन एंड एंजाइटी रिलेटेड टू पेन? Yes, Mr. Devappa, it is a very common finding that many of the patients whom we see, they are already depressed or in lot of anxiety. The That is the reason why I chose this. My focus for this topic is as diagnosis. काफी बार क्या होता है कि पेशेंट को खुद को मालूम नहीं रहता है कि उसको एक्चुअली हुआ क्या है. If a doctor is not able to give a proper diagnosis to the patient, patient is wondering what is wrong with me. So especially in chronic cases where people are suffering for months and years together, and if they are not told what is actually wrong with them, then the anxiety depression starts building up. I've had many patients who come and say that they have headache, and they don't know the reason why. So they feel that they are having brain tumor, and they start going into depression, anxiety, and all those kind of things. So until and unless we as doctors can give more or less accurate diagnosis to the patient, most of their anxiety and depression is taken away. If patient comes to know, अगर patient को मालूम पड़ा, okay, my headache is because of the neck pain which I have. काफी बार हम लोग देखते हैं कि a whiplash injury which happens in a accident wherein a sudden moving vehicle stops when it meets with an accident. The person sitting in the vehicle or on the bike or on the scooter, his neck is uh, goes forward and comes back at a rapid rate. So this causes a lot of pain in the neck, a lot of pressure on the joints. So this we call a whiplash injury. After some years of this injury, the person starts having neck pain, which can radiate into the head. And after a few years, the headache is so much that person feels that there is something wrong in the head. So until and unless he gets that diagnosis, he will be very anxious. And if nobody can give him a diagnosis, then he starts going to depression. So as long as we can give a proper diagnosis or proper information to the patient about his problem. Even in cancer, if you don't tell the patient what he's suffering from, if you try to hide the fact that he's suffering from cancer, the patient starts wondering what is wrong with him. So I always believe that patient should be told and explained about his illness properly in whatever ways you can and whatever ways patient can understand, and be very realistic with the patient. That's how you can motivate the patient to take care of himself. So that's how we can take care of anxiety and depression. So in the regarding your question, pain as such does not depression and anxiety does not cause pain, but if you don't treat the pain, then the patient can get anxious and depressed. So I hope you're satisfied, Mr. Devappa. I read some question about migraine. Yes, Hitesh Bhavsar. Dear doctor, many time I had severe migraine pain. Please suggest some useful tips to avoid and manage this pain. Yes, migraine is a very common problem. You need to find out, Mr. Hitesh, that there are some triggering factors for migraine. जैसे कि कुछ खाने की चीज होती है, या फिर तेज धूप होती है, या कुछ स्मेल होता है जिससे कि ये ट्रिगर होता है. So you are the best person to find out what is causing you pain, what triggers your headache, and you have to try to avoid that. Sometimes it is not possible. So if it's a clear cut migraine, if it's a diagnosed migraine, then what we normally do is there is one treatment to kind of abort the acute attack, and there is another treatment to prevent the further attack. This may take some time. So the treatment which is given in aborting the acute attack, you need to have those medications with you. So whenever at the earliest onset of the what we call the aura, you have to take certain medication like paracetamol, at the onset of that headache, so that the headache does not cross, it does not increase and cause you trouble. So many times we see that that kind of treatment helps. Taking a headache medicine at onset of headache rather than waiting for a full blown headache and then taking medicine. Many people try to control the headache, not to take painkiller, but I feel you should not do that. We have seen that many times the migraine, it passes off after a certain age, say 35, 40 years. Uh, so it passes off. Uh, so I think migraine is not a very bad thing to have. Yes, it troubles you a lot, but main thing is take regular medications as prescribed to you by the doctor, and avoid things which trigger your headaches. But one caution here, many times a cervicogenic headache, as I said, that whiplash injury causing neck pain gives rise to a headache. Usually it is unilateral, and many times there is a confusion between a cervicogenic headache and a migraine, because many times even if, doctors are not aware of this entity called a cervicogenic headache, and they treat a unilateral headache mostly as a migraine headache. So I think you should get evaluated if you have neck pain also, and rule out a cervicogenic headache, because cervicogenic headache has a definitive treatment which can work very well for you. Uh, so till I get few more questions, let us proceed further about coming to a diagnosis, a proper diagnosis in cases where neck pain, back pain are involved. As I was coming to medial branch block, medial branch blocks are simple injections given in the spine on the nerves which supply the short joints of small joints of your spine, which are called the facet joints. About 20 to 40% of low back pain comes from these joints. Okay, so many people think that most of the pain is coming from the disc and the nerves, but facet joints are mostly underdiagnosed cases and undertreated cases. So, in my opinion, if you can diagnose facet joint pain and the treatment is so good that people can suffer less because of a facet joint pain. In this facet joint treatment, what we do is we do a diagnostic injection of a local anesthetic around the medial branches. We wait for a couple of days. We ask the patient how is he feeling after the block. If the pain is reduced by say more than for 50 to 60%, then we confirm that the pain is actually coming from that facet joint, and then we go ahead doing the radio frequency of those joints, and that relieves the pain for a long, long time. I have Mr. Dinanath Dinkar who's asking about my kidney is suffering from throat cancer and severe pain due to chemotherapy. Please advise how to manage. Uh, yes, sir. Cancer with chemotherapy is, yes, it's a very complicated thing and it can give rise to pain. Cancer itself can give rise to pain. In the throat area, it's even more difficult because there could be problem in breathing, there could be problem in swallowing, plus the pain. There are so many nerves which are very close by, and the chemotherapy pain. Chemotherapy pain is usually the neuropathic pain which we get because of nerves getting involved. So ये पेन को ट्रीट करने के लिए what I would advise is he will have to take simple painkillers like the NSAIDs for few days, but the main therapy would be around narcotic therapy, which is in form of either patches like the fentanyl, buprenorphine patches, and along with anti-neuropathic medications like tricyclic antidepressants and other neuropathic medications. जो गाबापेंटिन होता है, प्रीगाबलिन होता है, डोथाइपिन होता है. So these medicines will work and control his pain, if not totally take cure his pain. So it's a tough situation what you are facing with your relative, Mr. Dinkar, but I think these methods would help him. Taking a NSAID like a painkiller, normal painkiller जो होता है, along with that either pregabalin, dothipin or gabapentin, and a narcotic in form of patches. Because I think giving morphine as a uh, oral treatment may be difficult in your patient because he may not be able to swallow. So transdermal patches of either fentanyl or buprenorphine will be very helpful. Yes, you're welcome, Mr. Dinkar. Till you get any more questions, I would just like to say that in this COVID times, it is very difficult times for patients who are suffering from these chronic pains like cancer pains and trigeminal neuralgias and back pains. Because as authorities have advised us that all the routine cases or routine treatments should not take place or take place at a lesser scale in these times, and only emergencies to be treated. But believe you me that for these patients, what may not be an emergency for a other person, to these patients, their pain and the suffering which they undergo is a real emergency. So I feel that since India is opening up, you should visit your doctors, you should go to hospitals if you are suffering in pain, and which is quite bad. Also, if it's not very important or not very urgent, then do contact your doctors online. If anybody wants to contact me, our numbers are there, and we can help you over phone. So, Manish Kumar Thakur is asking, Doctor, how can we treat bumps pain? See, bumps pain is an infective pain. Okay, so that will pass off after the infection settles down. So uh, I think the best treatment is after the infection settles down. Till it's there, that simple painkiller like NSAID, which is like a diclofenac or simple paracetamol, can also help. Mr. Dayanand Kurmi is asking, at what stage cancer person realizes pain? Yes, a very interesting question, because most of the cancers are diagnosed very late, because in early stages they do not cause pain. They cause pain only when the cancer tissues invade the deeper structures, the nervous tissues or the bones. So generally, the diagnosis itself is late. So that is why regular screening may be helpful. So it's, I think somebody had asked about the regular screening in early days. Yes, after certain age, regular screening should be done, especially if you have a strong family history of cancer. But generally, yes, cancer is presented late, and because the pain is delayed, cancer growth generally initially it's painless. It's not a painful growth, so that is why it is diagnosed late. So I think, as I was just saying, that these COVID times, cancer patients especially have a lot of trouble because they are scared to go to doctors, because they are considered to be the vulnerable groups. At the same time, they suffer so much that it's difficult for them to sometimes manage, difficult for others to manage them at home. So if it's really required, if you feel that it's a necessity, then you should go to visit a hospital and consult your doctors. Do not be scared now. Many of the doctors have they are open. They have, their clinics are open, so do not feel to consult your doctors at regular intervals. Kiran Jaiswal is asking, "Hi sir, what would be the cause of any spine pain?" किरण जी नमस्ते। मेरे से ज्यादा तो आप जानते हो सर जी स्पाइन पेन के बारे में। मिस्टर किरण इज अ वेरी क्लोज फ्रेंड ऑफ माइन। वो तो शायद आई थिंक ही इज हैविंग अ सेशन इन कपल ऑफ डेज, सो आई थिंक यू आर द बेस्ट पर्सन किरण टू आंसर दोस क्वेश्चंस। All right, ladies and gentlemen, I think in about 45 minutes I've tried to answer as many questions as we got. And I just wish that all of us can stay safe. Don't forget the basic care of hand washing, maintaining physical distance, and sanitization. So let's all hope that we get through this COVID pandemic as soon as possible. And I really believe that together we can do it. So thank you very much. Thank you very much, Six Eye Pain Healthcare, for organizing these wonderful sessions with you love wonderful people. So thank you very much. I was just offline because of net issues. So I thank you again. I thank you, Devinder, for having me here and hope to see you again if needed. Thank you very much. Bye bye.